This is Duke University.
This is Office Hours at Duke University. Today, Professor Anirudh Krishna is taking your questions on why people become poor. Professor Krishna is an Associate Professor of Public Policy and Political Science and Associate Dean for International Academic Programs at Duke's Sanford School of Public Policy. He has spent the past decade analyzing the roots of poverty worldwide. He is also the author of the recently released book, One Illness Away: Why People Become Poor and How They Escape Poverty. One Illness Away draws on Krishna's study of more than 35,000 households in 400 communities in countries including India, Kenya, Uganda, Peru, and the United States. To ask Professor Krishna a question, send an email to live@duke.edu, tweet with the tag Duke Live, or post to the Duke University Facebook page. You can watch today's discussion again anytime on Duke On Demand.
I'm David Jarmel, the head of Duke's Office of News and Communications, and I'm here with Anirudh Krishna of Duke's Sanford School of Public Policy. Professor Krishna, when the U.S. Census Bureau recently released its annual report on poverty in the United States, it found that 46 million people, that's more than 14% of the American population, is living in poverty here in what's supposed to be the richest country on earth. Why are so many people poor?
David, thank you for inviting me today. I'm very happy to answer that question because it relates centrally to 10 years of research that I have been doing, looking into the question of how come people are poor? How many of them were born poor? And how many others have become poor? And this research took me to different countries. It took me to India and Kenya and Peru and Uganda, but also right here in North Carolina. And what I found was startling at first, but it seems obvious now. What I found was that poverty is not just being removed. People aren't just coming out of poverty. They are. But there's also large numbers of people falling into poverty. And I started thinking of this in terms of the analogy of a bathtub. There's a level of water in the bathtub, which is the number of people who are poor at any particular point. There's a drain that's taking people out of the bathtub, but there's also a faucet that's putting more people into the bathtub. And all over the world, the same thing's happening. The faucet is flowing fast. People are becoming poor who didn't used to be poor before, and other people are moving out. And the level of water in the bathtub, the percentage of people who are poor at any particular point in time, is a resultant of both sets of poverty flows, the inflow and the outflow.
Right, and one of the main points of your book is that we as a country and policymakers tend to focus on the level of the water overall, and what you're telling us is we need to understand why individuals become poor or alternatively rise out of poverty. And to put a human face on that, I wonder if you could tell us the story of Khadija from Uganda.
Thank you very much, David. That's one of my favorite stories. So Khadija was this woman. She was about 45 years old when I met her and interviewed her in Kenya. This was in 2004. And when I spoke to her, she was desperately poor. But 10 years before that, in 1994, she lived a comfortable middle-class existence. She and her husband both had jobs in a coffee processing plant. They grow coffee in that region. And their children went to good schools. But then one day, out of the blue, her husband, who was traveling in a minibus, they call it a matatu over there, met with a road accident. He was killed. 10 other people were killed. There was no compensation or any kind of monetary support. So more than half of their income suddenly disappeared. That was bad, but it wasn't terrible. Khadija could still manage. She had her job, but then a couple of years after that, the coffee plant developed a disease in that region, and the coffee factory closed down. Khadija lost her job. That was the first whammy, but the double whammy was her son fell desperately ill. And she consulted lots of first local healers and then doctors in big hospitals, spent lots of money but couldn't save him. 2 years after, he died too.
Yeah.
But in the process, she had to sell her house, she had to sell her cattle, she had to sell the small farm that she had just in order to pay for his medical treatment. And by the time I met her, she and her daughter were living in a small shack. And she used to go out and work at whatever she could, whatever paid her a wage from day to day. And they were desperately poor. And there are hundreds and thousands of other stories of the same kind, David.
Right, and before we get, I know we're going to talk a lot about the potential solutions for her and others, but just to help frame this conversation for people who are watching and joining us, maybe tell us one more story. Tell us a story about Shantabai from India, a different part of the world.
Shantabai in India. Her story should be familiar to you, David, from the time you've spent in Nepal. Shantabai's story is quite similar to Khadijas' story, despite being in a completely different context, despite being in India where economic rates of growth have been going through the sky in the last 10 or 15 years. Shantabai lives in Gujarat, in a village in Gujarat, a state that has been at the forefront of India's economic growth. She and her husband lived in this rather palatial house in a village. Her husband was a merchant. He owned a grocery store, rather an all-purpose store in their village. They also had agricultural lands and they lived quite well. Until one day, her husband, like Khadija's son, fell seriously ill. He lay in bed for 2 years. They tried all kinds of treatments, spent lots of money, but he died. When he died, then she ought to have inherited his property, but according to the customary inheritance norms of that area, she got tiny bits of the property and his brothers got the rest of it. And then soon after that, her older daughter had to be married off, and they were still pretending to be middle class, like so many people who've fallen into poverty. And so they arranged a grand wedding, spent lots of money, and borrowed money from money lenders at high rates of interest. One thing I forgot to say, before her daughter got married, soon after her husband died, it was also a customary death feast, a funeral feast that she had to put together for her husband, and she borrowed money for that. So now she has 2 loans,
Right.
which she's repaying. The rate of interest has risen to 5% per month, compounded monthly. It's huge, and it's growing all the time. So she takes stock of her situation, and she decides she has to sell off her assets in order to pay back the loan.
Right.
She sells off the bits of agricultural land that she has, and when I met her, she was sitting in this hulk of a house on this tattered string cart, and hanging behind her was this photograph, this faded photograph of her marriage with this merchant, and everybody was looking happy, but there was this miserable woman who could see no future for herself.
Right. So there we have 2 personal examples of what you're talking about. And some of the factors that you mentioned in those 2 stories were an expensive wedding, an expensive funeral, high rates of debt, all of which you talk about in your research. But the most important unifying theme that you mentioned is medical expenses. And the title of your new book is One Illness Away. Do you think that that's an especially important factor?
I think that's the critically important factor, David. And I think that's critically important in country after country, no matter how rich or how poor that country is on average.
Yeah.
And I see the same story happening in the United States. So the way we did this research was we identified people in each of the communities we studied who had either fallen into poverty or who had come out of poverty or who had never been poor or who had always been poor. And then we asked for their life stories. We asked for their life stories in terms of critical events and turning points that had influenced those economic trajectories. And we have thousands of these stories, my colleagues and I who did this research together. And then we looked to see what's the difference in the stories of people who've fallen into poverty versus others who've never been poor.
Right.
And in more than 2/3 of those cases, a severe health incident and high healthcare costs was the difference. Now, let me be clear here. It wasn't usually a single event that pitched somebody into poverty. It was usually a series of events that pushed people gradually by degrees into poverty from which they could not come back out. Among those events, there were some that are common across countries and some that are very country specific. You mentioned expensive marriages. That's a particularly Indian phenomena. You also mentioned expensive funerals. Well, we found that in parts of India, but also in parts of Kenya and Uganda. But the one thing that we found everywhere in all 5 countries that we studied, rich and poor, was healthcare and high healthcare costs.
Right. I want to talk in a moment about healthcare in the United States, but first I want to remind all of you who are watching that we welcome your questions for Professor Krishna. You can send them to us in a variety of ways. And we have a question from Antonia, Professor Krishna, and she asks, do you see a difference in the roots of poverty in a first world democracy such as the United States and in third world countries? You said there are a lot of similarities, but are there any fundamental differences?
I see two important differences here, David. First of all is the difference in the definition and the measure of poverty. You don't have the same measure in the US or in India, or in Kenya for that matter. The United Nations and the World Bank use a measure of $1.25 a day for poorer countries and a measure closer to $11 a day for rich countries, and that's as it should be, because poverty is a relative term. It's my relationship to what I have and what I don't have and what you have and what I ought to have, and those understandings keep changing and evolving as societies change. I mean, if you just think about it, if you're living in the Stone Age, your understanding of relative deprivation or poverty would be very different from your understanding here. So one difference across richer and poor countries is in the measure. But another important difference is the way in which poverty is treated by society. By and large, in the developing countries that I studied, and this would have resonance with your own examples, David, people are not stigmatized for being poor. Very few people, particularly very few poor people, believe that you're poor for your own failures, for your own faults, for your own lack of effort. Rather, people realize that very many poor people, the majority, are poor because of reasons beyond their control, because of a healthcare incident, because of debt, because of landlessness, because of drought. These are things over which individuals have very little control, and they become poor for reasons not of their own making. In the United States, the percentage of people who believe in this origin of poverty is much smaller.
Right, and I'm guessing that by implication people think you're poor because your character, you're lazy, you're drunk, a whole host of reasons. And you're saying that that's more true in the United States.
That's more true in the United States, which is why we had a big problem when we went out to communities in rural North Carolina to get people to talk about poverty. And so in our discussions with them, we completely took out the term poverty and we spoke of it in terms of this methodology I've developed about stages of progress and the people at a particular stage being below people at another stage. But let me also say one more thing here, David, if I may. This business about thinking that the poor are poor for character defect is not a particularly American phenomena. I grew up in New Delhi. I grew up in a middle-class household in New Delhi. And my grandmother used to say the same things to me. She used to say, don't go out play with those poor kids. You'll acquire bad habits from them. And I was 8 or 9 years old, and I believed what my grandmother told me, except many years later when I went out and looked for myself and realized that these were just grandmother's stories. There was very little truth to it. As a matter of fact, in each of those different places where we did our studies, my colleagues and I worked with a whole set of colleagues to interview all these thousands of households.
Right, 35,000.
35,000.
And you personally say you've interacted with 1,000 or more families just yourself, talking to them and having tea and getting to know their situation.
Close to 1,000, David. I spent 10 years doing that. That's enough time to interview 1,000 people.
Right.
But my colleagues included academics, it included NGO people, it included most of all young men and women from the communities such as the ones we examine. And one of the things we did was we deliberately asked about drunkenness, drug addiction, laziness, all of these negative character attributes, and we found those percentages to be fairly similar across the poor and non-poor categories. Luckily, in both categories, the number was small. It was less than 5%.
So we have a question that we've received that's right on this topic, and it's a bit long. It's 2 sentences. Let me read it to you. From my own observations and experience, there is a poverty culture and a poverty mentality that robs individuals here of the ambition, will, skills, and personal beliefs that make it possible to succeed when opportunities abound for those who have what I call an abundance mentality, that set of beliefs, attitudes, and goals. What do you think of that?
I think there's a lot to that. So one part of poverty is this business about falling in, and we've been discussing that so far. But the other part of poverty is about getting out of poverty. And in the book, I crudely summarize my argument in a mathematical equation by saying poverty is equal to frequent downward tugs like those illnesses and things, plus limited upward mobility. And that limited upward mobility is quite largely a factor of where you grow up. If you're growing up in a community where all around you are only people who are either jobless or who have low-paying jobs, then where are you going to get information about the other things that exist out there that you can aspire to become? And so I saw hundreds and hundreds, and I can tell you stories about these kids.
Well, tell me the story about, and tell our viewers the story about Victor in Peru and his family, which managed to improve their family situation.
I will in a minute, David. Let me just respond to the question fully, though. What happens is, since the examples of other people in your community are themselves so impoverished, since your role models are themselves so limited, what you aspire to become in the future is limited by what you see, limited by the possibilities that appear before you. And so it's a culture of low aspirations, which arises because of lack of information, lack of role models. And so many, many smart, hardworking young people end up in low-paying, dead-end jobs coming from communities such as this. Now, Victor in Peru.
Yeah, Victor in Peru.
Victor in Peru grew up poor. He was a person who inherited poverty. But by dint of sheer hard work and some community supports, he and his wife were able to transcend poverty. They got a small plot of land from their community organization, and they raised first one and then multiple cows on that land. And from the milk from those cows, they produced cheese, and they started selling cheese, and they started going up the economic ladder. Luckily for them, there was no severe illness. There was no downward tug that could bring them down. So through sheer hard work, they were able to ratchet themselves up by degrees.
A reminder that you're watching Office Hours at Duke University, and we're speaking today with Professor Anirudh Krishna, and we invite your questions, which you can send to us through all the methods that you see on your screen. And we've received a question, Professor Krishna, on Facebook. And it says, simply impoverished people often have too many children they cannot provide for. It's generational poverty. What's your response to that?
My response to that is that that's true in a number of cases, but not true universally. Let's step back from the question and think about the issue from the point of view of an individual. Hypothetical, I am 55 years old. I'm looking into my old age. There is no old age insurance in my country or my community. There are no nursing homes where I can go and spend the twilight years of my life. So what I have to have are children who will look after me when I'm old and disabled. And when infant mortality in that country is also high, and when the norm is only for sons to look after elderly parents, then I will try to have at least two sons surviving into adulthood, so that if one of them turns out to be a rotten apple, the other one will care for me. In order to have two sons surviving into adulthood, I need to have more than two children, 4, 5, 6, depending on the ratio of boys and girls and depending upon infant mortality. And so it makes eminent sense from the point of view of an individual to have large numbers of children. It also makes eminent sense to have large numbers of children because of the pathways that people have for improving their economic conditions. And in most cases, in all of the developing countries that we studied, the people who've moved up have done so by diversifying their families' income sources, doing 2 jobs, doing 3 jobs, doing agriculture, and sending somebody out to the city to work as a day laborer, doing that and opening up a small grocery store in their village. And you need hands to do that. So family size can cut both ways. It's more mouths to feed, but it's also more hands to work. And that's the critical equation. At an aggregate level, certainly having more children adds to population, and that goes into the denominator of the mathematical calculation, and GDP per capita falls. But unless policy makes it rational for an individual to choose to have fewer kids, that's not going to happen.
Right. Let's go back to healthcare for a minute. We talked about that briefly and then got on to other things. And you're saying that healthcare is one of the most, perhaps the most important factor causing families to fall into poverty and also affecting them rising from that. We've just, over the past year, gone through a grueling healthcare debate here in the United States. And all you need to do is look at the current election campaign and to see that there doesn't seem to be much appetite in the United States right now for further healthcare reform. The many Republican candidates are blasting the recent healthcare legislation. Some Democrats seem to be backing away from it on the campaign trail, and it doesn't seem very likely there's going to be a great expansion of healthcare in the United States anytime soon. Assuming that that's the case, you're saying that that's not only going to affect healthcare, it's going to affect poverty. Maybe you could talk about that.
There's both micro level and macro level evidence for believing that poverty cannot be fixed unless healthcare is fixed first. And the micro level stories are these hundreds, thousands of stories from all of these different countries, including from right around here, of people who've fallen into poverty and of people who've remained poor despite trying. Healthcare is the one thread that runs right across these stories. But if you were to step away from that and look at the examples of different countries, and if you look across the world at countries that have the lowest rates of poverty relative to their per capita GNP, then you come across countries that you expect to come across, such as Sweden and Norway, but you also come across countries like South Korea and Costa Rica. And what unites those countries is not their average level of wealth. What unites those countries is the provision of healthcare at affordable prices through multiple alternative means. I'm not saying that the state should provide free healthcare for everybody. That's one model that some countries have found appropriate. But there's all these other models out there, and we need to pick a model that will allow somebody to pay for a sick child's treatment without losing their shirt or without losing the house they live in.
Right. We received a question by email from Stuart. Stuart asks, were you disappointed that our recent debate in this country over health insurance reform didn't address the connections between poverty and the provision of health care?
Deeply, yes, and I think that should come in front and center into further discussions of healthcare reform. I don't think this discussion is going away.
Yeah. A reminder that we welcome your questions as well for Professor Krishna here on Office Hours. And let me ask you, change the subject of this debate. You referred earlier to India, of course, which is often held up as an example of economic miracle along with China. But you say be careful about seeing that. Again, you have to go beyond the macro statistics to look at what's happening to individuals. And you caution us that even in those two countries as well as elsewhere, that there's still a lot of poverty behind the scenes.
In India particularly, there is a lot of poverty, and there's an ongoing debate in India, which is not coming to any resolution, about how many poor people there actually are. Because if you measure it in different ways, you get different numbers. But one thing that all these different sets of numbers show is that the rate of reduction, the pace at which, the speed at which poverty is being reduced has slowed down, even as the pace of economic growth has accelerated. And what's happening here, David, is I think that a lot of people are being left behind because they are not able to get their hook into this engine of high-speed growth. And one of the problems that I see, and this is actually a recent piece of research I'm working on, where I'm looking at large numbers of people and seeing how they have fared over the period from the mid-90s to the mid-2000s. And what I'm finding is quite startling. What I'm finding is among rural Indians, people who live in villages, who are still about 70% of all of India and likely to stay at that number, among those people who live within 5 kilometers, 3 miles from the nearest city, per capita incomes in real inflation-adjusted terms have gone up between the mid-1990s and the mid-2000s over this 10-year period. But for people who live more than 5 kilometers away from cities, large numbers have seen their real per capita incomes fall in inflation-adjusted terms. Which means that 40 to 50% of all Indians may have seen income declines during the period of high-speed growth, and distance to city, distance to town captures a lot of what's going on.
Let me just say that back, what you just said. We're hearing about India and its economic miracle, and you just said as many as half of Indians have actually declined in their poverty status.
So the average per capita incomes in rural settlements that are more than 5 kilometers away from the nearest city have fallen. Not everybody's have fallen, but on average, there's been negative income changes being experienced by these families. More than 80% of all rural Indians live more than 5 kilometers away from the nearest city, and more than 70% of all Indians are rural. You add those numbers up, you get somewhere close to half of all Indians. Distance from city is important because current day economic growth is a city-based phenomena. The services sector, computers, call centers, software, legal aid. These are the kinds of sectors that have seen the big growth spurts in India. And those are the sectors that are all based in cities. The further away you are from a city, the further your physical and your cognitive distance and your preparedness to be a part of this kind of modern economic growth.
Right, and you did a study of the software industry in Bangalore, one of the great boom cities in India, and you found that very few people who were working in the software industry there come from very poor families. Typically, they would come from more prosperous and middle-class families.
More middle-class families, more small and medium towns, and very few from rural villages. But there were enough of those young people around for some useful policy-relevant conclusions to come about. I mean, can I tell you a story? Do we have time?
Please do.
So I met this very impressive young woman called Vasundhara. The way we did this research was we went to 3 different software companies in Bangalore, different sizes, different sectors, explained the purpose of our study, and asked them if we could run a questionnaire by a random sample of their new entrants, people who they hired in the last 5 years. And these old people being computer specialists, we put this questionnaire up on the internet, gave them passwords to access it, collected their responses, and then I went back to Bangalore and interviewed a subset of these people whom I thought to be most interesting, Vasundhara was one of these people. I hope she's listening in today because I found her an inspiration. She grew up in a poor household in a backward village. Her parents are illiterate. No one else from her family has been to school. In her village, you can only study up to grade 5 because that's when school ends in her village. She studied up to grade 5, insisted with her parents that she wanted to study further, so they sent her to her grandparents' village where there was school up to class grade 8.
Yeah.
She studied there to grade 8, and that's when the story gets interesting because in ordinary circumstances that would have been the end of the road for her. But there was a school teacher. And this school teacher discovered that Vasundhara was an unusually talented woman, young woman. And so he worked with her. He obtained for her information about a competitive fellowship program that the government of India runs. He worked with her after school hours to prepare her for that examination through which she could get this fellowship, and he made sure she got the fellowship. So she did very well. She won the fellowship. The next task was to go and persuade her parents that it was okay to send her to the high school in the city. And the school teacher went to her parents and repeatedly told them, look, I have people in that city. She's going to be safe there. It's not a big problem. So she goes to the city high school. She does very well there. She would have, as you'd expect her to, because she's really smart. And then she gets into engineering college, and then she gets into one of these, top-notch software companies in Bangalore, and she's doing very well. 2 or 3 things here are really important. First, information about the opportunities that exist, about that fellowship scheme, about the high school in the city, about the engineering college, about the possibility of becoming a software engineer. It was unknown in her village until this one school teacher connected her up with these opportunities.
Right.
Now, she's very lucky to have had this school teacher. There are hundreds and thousands of other smart, talented kids living in poorer communities who have none of these opportunities.
Who just never hear about it.
And we see examples of that right around here, which is why initiatives like the Harlem Children's Zone are required in great numbers in the United States and elsewhere.
So let's talk about that. We've spent several minutes now talking about India and Peru and Uganda, and we've heard some fascinating stories about individuals who've fallen into poverty, who've begun to climb out of poverty. Here in the United States, we have millions of people who are in poverty. If you were both the president and the head of Congress and you had absolute power here, what would you do to reduce poverty? I mean, at the end of the day, then, what do we do to reduce poverty in this country?
2 sets of things, David. One is put a floor below people. Put a safety net.
What does that mean?
In large part, that means affordable health care. But that's not all. Mm-hmm. It also means information about budgeting. We found that to be very important in North Carolina communities, where community organizers had been working with people and teaching them budgeting skills about how to manage the monthly budget of a family. Far fewer people had fallen into poverty and many more had come out. That's important. Healthcare is important. And equally, opportunity is important. I mean, the United States is the land of opportunity, and it should be the land of opportunity for people who currently lack opportunity in the United States, and people living in remote rural communities or inner city communities do not face the same structure of opportunities for a variety of reasons that researchers have identified. And those are the 2 things that I would concentrate on, but perhaps I'd run away from that position before I could do anything like that.
Yeah. I want to talk for a minute about how you got interested in this. You told us very briefly about growing up in New Delhi, about your grandmother. And in fact, you spent many years before you entered the academic world out in the field in India, if I'm not mistaken. And maybe you could tell us a little about your own journey from, as you said, a middle-class family in India to spending many years of your life in the developing world trying to understand poverty. How did that come about?
It wasn't preordained in any way, David. When I was growing up, I'm sure my middle class parents entertained aspirations for me to become a middle class professional, a doctor or a lawyer or a civil servant, and that's the path I was going, except mountaineering and high altitude hiking became a passion of mine when I was in high school.
Where?
Not so much in Nepal, but in the Himalayas in India. And I'd go out every summer and whenever I could, and we'd pass through villages before we came to the peaks, and we'd spend several nights living in those villages, and that's where I came face to face with poverty for the first time. Actually, that's not true. You see, I used to see poverty all around me in New Delhi. But living in one of those situations, you develop this kind of cloak of invisibility in which you really don't see poor people. And I must confess, I was the same myself until I started going out into these village communities, living with these people, talking to them, getting to know them as human beings, and then being amazed to see how people who were as smart or smarter than me did not see the same kinds of opportunities for themselves. I mean, I talked to these people, I talked to these kids in those villages the same age as I and say, what are you planning to do once you finish
Right.
high school? And they'd say, what kind of dumb question is that? I want to come back and farm my...
But eventually you ended up spending years out in the field working, not as an academic, but with the administrative service, or
Yes.
maybe you can explain that.
So I joined the Indian Administrative Service in 1982, and one of the major motivations for doing that was to go out and help manage these government programs that were intended to improve the lives of poor communities and poor people. And I did that for almost 15 years, and I enjoyed doing that a great deal, and I learned a great deal from it. And then in 1995, I came out on a one-year sabbatical to Cornell University and realized that it was time to come back to academia and to
Yeah.
develop some newer and better answers to the questions of poverty, because a lot of what we were doing out in the field was these old and tired solutions.
Yeah. You referred a couple of times to Nepal. Just so our viewers know, I was a Peace Corps volunteer in Nepal, and now might be a good time to mention that in February 2011, those of us who are former volunteers here on the Duke faculty and staff, and our hundreds of alumni, are working with members of the faculty and people across the Duke community to try to put the spotlight on global development issues, as we're talking about here today. And we're going to have a conference called A World Together, which is in February 2011. There's information about it off the Duke homepage, and anyone who's watching who's interested in global development, we invite you to take a look and hopefully to join us here on the Duke campus in February. Professor Krishna, let me close with a final question. Maybe you can tell us about the research that you and your students are doing now and the kinds of questions you're looking to explore in the future.
So we're doing a bunch of different things, all of which are related to these questions of poverty and powerlessness, David. I'm planning to go out in spring with a selected group of undergraduates who are deeply interested in questions of poverty, environment, and global health, and we are going to be working for a semester in Udaipur, a town in North India, which has a clutch of really good NGOs, and we'll be doing classes for half the week, and for the other half of the week we'll be going out into villages and actually living with those communities so that we get to check out what we've read in the books with the reality on the ground. This is the global semester abroad. In another set of research, I'm working with some students and some NGOs to look at the question of internal migration. There's very large numbers of people who are moving from rural areas to cities for all of the reasons we discussed in India, in China, in Indonesia, in Bangladesh, all over Asia and Africa. There's millions of people who are moving. And yet a lot of the academic research and policy discussion is about cross-border migration, which is minuscule in comparison. And so one of the things I'd like to find out more is what happens to people who migrate. What are the different stages they pass through as they go from their village to a city? What kinds of pitfalls do they experience? How can policy make this inevitable transition more humane? And then the last question I'm looking to see is, how can more Vasundaras, the young woman that we were talking about, the software engineer, how can more Vasundaras be facilitated? How can more smart, hardworking young people from poor communities have a better real chance of rising to positions that are commensurate with their capabilities? And this social mobility research I'm doing together with a growing group of academics and practitioners starting in India.
Such interesting research and so important for not only our own country, but for people around the world. Professor Krishna, thank you for joining us here on Office Hours this week. A recording of today's conversation, along with many other videos, will be available on Duke On Demand. Thanks for joining us.
Watch Duke.
On demand.
ondemand.duke.edu.
This week on Duke On Demand, the evolutionary battle of bed bugs is the topic in a video podcast from the National Evolutionary Synthesis Center, co-operated by Duke.
Here we have a tale of bugs meet poison. Poison kills most bugs. Remaining bugs conquer the poison and return home. Not a nice bedtime story from our point of view, but a classic in terms of evolution in action.
Also this week, a lesson in drumming and dance from the Resurrection Dance Theater of Haiti.
Supreme Court Justice Samuel Alito on his career in the law.
And Duke Idea Public Conversations explore the importance of ideas in an increasingly interconnected world. ondemand.duke.edu